Good evening, everyone. It's 6:30 p.m. and this is the work session for the City Council. And I'll call our work session to order. And our work sessions are very informal. And tonight we have Planning Commission members joining us at this session. So what we'll do is we'll go around the room and introduce ourselves so everyone knows who everyone is, because I know two of the commissioners are new this year, so we welcome you. Elizabeth Couts, Mayor.
Michelle Brooks, City Clerk.
Mary Sherry, Council.
Bill Coughlin, Council.
Tom Hanson, City Staff.
Steve Albrecht, City Staff.
Brian Sorensen, Dakota County.
Dave Turner, Planning Commission.
I'm Craig Ebling for the city staff.
Steve Manhart, Planning Commission.
John Corey, Planning Commission.
And then to the back of the room, you, Sue.
Sue Fast, Environmental Specialist, City Staff.
Brian Carlson, city staff. BJ Jungman, city staff.
Jenny Faulkner, Community Development Director, City Staff.
Ken Slipka, Chair of the Economic Development Commission.
Skip Neathouse, City Staff. Chris Lania, Planning Department.
And
John Gessner, This Week Newspaper.
Claire Kennedy, Patch.
yeah, welcome everybody. And Mr. Slipka, I had invited him to join us at the table. He's one of our commissioners for the Economic Development Commission, but he has to exit a little early, so. But thank you so much for coming. The first item on our agenda is the MnDOT presentation for the 2012-13 improvement, but they have asked that we reschedule this due to illness, and so we will move on. Then our staff will reschedule this item, and it'll be at a future date. And so the next item on the agenda is the Dakota County Transportation Plan presentation, and Mr. Steve Albrecht, our Director of Public Works, is going to present.
Madam Mayor, members of the council, we're here before you tonight to give the council an overview of the Dakota County 2030 Transportation Plan, along with our Planning Commission and Economic Development Commission. Assistant County Engineer Brian Sorensen is here tonight, and he will give you a brief overview of the 2030 plan and some of the issues and how they may impact Burnsville. In your background, you'll notice we really noted two items. The most of it was very common comments that we would have for a transportation plan, things that will work out with county staff. Two of particular interest to the city were the mention that County Road 42 could be potentially considered for a jurisdictional change in the future. And Brian will touch on why that's in the plan and what Dakota County's thoughts are on that. And then the second was the potential for some long-range intersection improvements along 42 that, in our mind, could limit access and some other things in our commercial area. And so Brian will also touch on that briefly. But those were the two items that staff wanted to make the council aware of. This is a long-range plan. Remember, we're talking about a 20-year planning period, and so things change a lot, as we can think, in the last 10 years. And so with that, I'll turn it over to the Assistant County Engineer, Brian Sorensen.
Thank you. And welcome, Brian.
Thank you, Madam Mayor, for having me here tonight. Thank you to Steve for the introduction. First things first, I come bearing gifts even after the holiday season. We have newer county maps. So I think late summer, early fall, these were first printed. So I thought maybe if you haven't had a chance to get by our locations and grab yourself a map, I would bring some for you.
A mobile app is good too, to go on the map. And so, but thank you.
There's no electronics related to these maps right now, Mayor. They're just the old-fashioned paper kind, which do come in handy from time to time.
Yes.
I'm also tethered at the hip to my mobile map app, so I understand that. Again, thank you for having me, and I want to start with a thank you as well to Steve and his staff for their thorough review of the plan. We did get a set of comments that a lot of them, and I've been through them in detail, are going to result in some changes in text in the way that we explain the particular issue at hand. So we definitely appreciate them putting time in. And I know it was a busy time this fall for the Public Works staff, so we appreciate that. As Steve mentioned, there's a couple issues, and I'll just weave them into the presentation where they seem to fit, if that's okay. That said, if there are items the group here, and I know we have a combined group of council members and planning commission members, please stop me as we go. And this is a very detailed plan. If you've had a chance to page through it at all, it's got a ton of information in it. I'm going to try to summarize it in about 15 minutes. So I'm going to be clipping the tops of the issues and generally how the plan is laid out. But I'm definitely willing to go deeper into issues if there is something that's near to your heart in Burnsville. So that said, I will jump right in. And like I said, I'll try to move along fairly quickly. In essence, and I know the city's familiar with this, you've got your own comp plan, you've got your own transportation chapter, and I think you know how this works. Of course, this is the document that guides a lot of our decision making in the next probably 6-7 years until we develop another document. The time frame that we're looking out is over 2030, so it's 20 years that we're doing an assessment of needs, and what our approach is to trying to address some of those needs. So it's very important to us. The last transportation plan provided a lot of document during a lot of challenges in the last 10 years or so. 2004 actually was the last plan. A lot of growth and development was going on at that time. A lot of change in the way that the different modes of transportation and how they're used by people within the county. So that was a big change in 2004, the document that was developed, and that provided a lot of direction for us up until now. So we expect this to do the same looking ahead the next few years. How we arrived to this stage, really this has been probably over 2 years in development. So there's a lot of process here I won't get into, but public and agency involvement from our partners and also multiple public meetings. Of course, a lot of internal staff involved in pulling this together. We did have a committee of city engineers, representatives from within the county. We had 6 city engineers. It was not the Burnsville city engineer at the time, but we did have, I think it was Lakeville, Apple Valley, Egan, South St. Paul, Farmington, I'm probably forgetting one in there, but they were a big part of our policy development, and we did make a lot of changes to policy through this document. I think that'll help gear our decision making and especially our investments as we look forward to addressing our issues in the next 6-7 years. So that was an important part of the process, was having city engineers involved. We do have a planning commission at the county that was involved in the process, and then 3 county board workshops. Just touching on some of the trends that we're facing, and of course I know these are not unique to the county, and the cities are facing these as well, but these really drove a lot of the document. And the 4 that I've highlighted here, one is changing revenues, and we've seen a lot of change in the revenues just since the last plan. And of course, in 2008, we had a brand new transportation bill that changed the nature of state aid funding for the counties and made a huge improvement for us in how we look forward on our state aid system. And of course, federally, things are changing as well. And that, I guess the lack of an authorization right now is probably one of the challenges in trying to look forward here and get a feel for what we could be, how we could be positioning ourselves for making use of federal funding. But this is something, of course, that just continues to change over time, and these plans, in essence, become a snapshot. The aging system is really something that is jumping out at us now that didn't jump out so much even 7 years ago. And what we're seeing countywide, and I have a map here and I'll show, but the needs here are substantially higher as we start to look at our system. And of course, in 2004, we were really geared on how do we keep up with all the growth and expand the system. And right now, as we look forward, we're seeing that our system is really starting to age. And in Dakota County, of course, we saw a lot of growth in the 70s and the 80s. Those roads, those bridges, those signals, all those facilities are going to reach their useful life at some point, and those are challenges we face to a much higher degree now than we did even just a few years ago as we look forward. Alternative modes and demographics, obviously a lot of changes here, and certainly Burnsville has seen that. even with the 35W corridor. But when it comes to transit, it's a lot more integrated into our overall system now than it ever has been, and we expect that to continue to be the case as we look forward. Of course, not only 35W BRT, but our Cedar BRT as well. With that, there are some other aspects of that, and I know we could have a whole work session talking for hours on some of this, but we've got an aging population, and we've got the need to be able to keep up with the needs of our residents, and transit, other modes, being able to support walking, biking is also a critical part of that. And then lastly, continued growth, and I'll talk about the growth, and it doesn't seem as apparent right now, but we still need to ensure that our transportation system can support the growth that's shown in the city's comprehensive plans. And the cities are still showing a lot of growth in Dakota County. So that's a continued trend that we need to keep up with. So speaking of the growth, as we look back the last 20 years, the county grew about 45% in population, which is very substantial in trying to keep up with the needs from a transportation standpoint. As we look forward, maybe not quite as much, almost the same amount expected to be added, again, if the city's comp plans play out. About 120,000 people, which is down in percentage, but again, if you think of all the growth we've had in the county looking back 20 years, this is what the cities now are supporting in their comp plans when you look countywide. So what does this mean for us? As we did our plan back in '04, we were looking at a 5% increase in vehicle miles traveled on the county system. So even as we look back at the last 6 years now that the growth has slowed down, we're closer to about 1.5% annual. And as we look forward, we're much more close to that 1.5, maybe around 2% versus the jump we were dealing with 10 years ago. So our plan is organized into 6 main goals, and those goals include resources. We've got a goal that summarizes the overall resource needs in the county and how we address that. A big part of this plan development was integrating. We previously had a separate transit plan that was developed subsequent to the 2004 transportation plan. So as part of this process, we have fully integrated the transit plan into the transportation plan, and we think that's fully reflective of the county's approach and the region's approach in having transit a fully integrated part of the transportation system within the region. So we think that's appropriate. In addition to that, preservation of the system, management, replacement, and improvement and expansion, and I'll touch on each of those goals. So the resources overall, what we're showing in the plan, as we look back at the last plan from 2005 to 2025, we showed about $1 billion in needs total and about $600 million in revenue expected. So we were about 60% of the needs. What I don't have here is what we actually generated in revenue in that short time frame. And I think there's a lot of credit to be spread around, but we were able to add a lot to our resources over that period of time to address some of the needs, such as County Road 42 that has been so important in Burnsville now and will be as we look forward to the next 20 years. A lot of projects like that in the county, a lot of mega projects just in the last 10 years when you look at the interchanges along 35. A lot of improvements on Concord in South St. Paul and Inver Grove Heights. Of course, I mentioned the Cedar BRT project. A lot of major projects where we had to leverage our funds and try to find other sources of funds. And a lot of that was not assumed. Some of it was assumed, state and federal funding in the previous transportation plan. But I think when this plan first came through, it underlined the need to the board that we've got to find a way to leverage our own funds. And the county certainly did a good job of that, I think, in moving those bigger projects forward in the last few years. So as we look forward to the next 20 years, we've got about the same amount of challenge in front of us. The needs continue to go up, and the revenues are up a little bit, but not even in pace with the needs is the way we're laying it out in the plan. So a lot further challenge for us ahead, I think, in trying to leverage the county and local funds. So under resources, a lot of key policy changes, and I won't go through this, and we spent a lot of time on this, as I mentioned, with our city engineer committee. A lot of adjustments in the way that we are approaching funding our transportation system. A couple of the bigger things I think that the cities were a part of and have been very supportive of, storm sewer maintenance up until now has been city responsibility along the county system. And this is something we've heard from the cities over the years. Well, why is that? A lot of these systems are draining the county roads, and why is it the city's responsibility? And I think part of that is the cities are certainly set up well and do a better job of maintaining storm sewer systems because of their own infrastructure needs across the city. But what the change is here is the county will be funding, as far as repair and replacement of storm sewer systems, we'll be funding 80% of those systems right in the county roadway, and then we'll be funding per contributing share. So the water that ends up in the main line pipes, we would pay versus depending on how much water is ours. So I think this is a big change that the cities have been very supportive of, and I think makes a lot of sense when you look at making sure that the right funding streams are funding the right things when it comes to the public dollar.
I have a question, because when and this is stormwater, and because part of that goes through the system to the Met Council, is that where some of this goes?
No, that'd be sanitary.
That's just the
sewer,
sanitary?
Yep. Stormwater is in our different watersheds, Black Dog and such, that run off from the roadways.
Okay, and because it talks about storm and sewer systems, so are we separating both of those in the county right-of-ways?
We have a municipal storm sewer system that's our streets, essentially our drains from our streets, and then there's the county storm sewer system. And often, because of the proximity, the two have to work together, obviously. We have joint ponds that treat water from both our streets and the county streets, and so they're very integrated, as Brian was saying.
Yeah, my concern is, Craig, about 4 or 5 years back, we had an issue with the way the Met Council was charging us for that.
Madam Mayor and council members, we did. I think that's been kind of worked through. It had to do with Clearwater entering into the sanitary sewer system, but we really separate those two systems pretty clearly. So I think that that the integration that Steve and Brian are talking about here is well operated. Yeah.
Okay, so we won't get into any of that issue in the future with the Met Council.
No, the
Okay.
council shouldn't be involved in this.
It doesn't involve the Met Council. What it does involve long-term is us managing our water quality and the county being a contributor to that water quality, and how do we partner to do it the most cost-effective way, I think is really the
And I'm
bottom line.
glad that you're on top of that, Steve, because I know that was an issue that we really had to sort through, because the cost to the city was going to be very high. But as we worked through all of that, it came down. So thank you.
A couple other policies just to mention, Madam Mayor. Roundabouts is something actually wasn't even barely mentioned in our previous plan, and now, of course, it's as we go out and talk to the public, we hear it, and it doesn't matter what we're there to talk about. Somehow, roundabouts finds its way into the discussion.
Well, it's
so
a trend, and it moves traffic.
It
efficiently.
does, and it's a tool that will be much more prominent within Dakota County. We've seen that already at a bunch of different levels. I know Burnsville has a roundabout, and other cities are developing them as well, in addition to MnDOT. And we have one on Diffley and Ron in Egan right now, and we are in the planning process to add one at 50 and 60 in Lakeville, 185th Street in Kenwood. So, and that's gonna be a full multi-lane roundabout, 2 lanes all the way around. So it's a tool that used in the right place can be very effective. It can save cost, and it certainly reduces the severity that comes with crashes at intersections. And the crashes don't go away, and we're seeing that, but the severity of crashes is way down, which ultimately, that's what matters on our system. So It's going to be a tool that's much more prominent. We have developed a cost participation policy. We didn't have a policy before, so we weren't quite sure. We kind of had to feel our way through that with Egan as we built Diffley and Ron. And so now we have a formal policy that outlines how we'll participate. Another item, I guess, worth mentioning, smaller safety projects where there's clearly a safety benefit on the county system. Previously had been a share, had been a part of the 55-45 policy, and now the door is open for us if it's a purely safety project that the county could pay up to 100% on those types of projects. So there are things like street lights, maybe turn lanes, maybe closing a median, which sometimes gets a little touchy with city councils. You have to go and get an approval for that, where it's really for the county road system benefits. So little adjustments there, I think, to our policy are going to serve us well as we look forward to the next few years. As I mentioned, full integration of our transit plan into the transportation plan now. It's an entirely new chapter in the plan. The trick here, I think, for the county is we have a specific role to play. We are not an operator. It's hard to talk about transit though holistically without getting into operation, and we do a little bit of funding, and of course are part of a bigger funding picture when it comes to the region, when it comes to Met Council, when it comes to CTIB, the County Transit Improvement Board. So that was probably the trickiest part about this chapter, is clarifying our role, but we did do that within the text of the document. And then it's important not to forget about the pedestrian and bicycling modes. And I think we agree we need a greater emphasis on that, and that's been a challenge, I think, for Dakota County, our transportation, especially because of all the roads that we manage and maintain within the suburbs, where pedestrians and bicycles aren't quite as prominent as they are in the inner cities. And how do we do that? And we do have you'll see things in here like trail gap map, where there need to be some connections made. We've got a pretty sizable gap right along 42 in Burnsville that we'd like to address in the short term if that's possible. So definitely a greater emphasis. We've got money set aside in the CIP now to deal with some of those issues, or maybe that had been a little bit more difficult in the past. So definitely don't want to lose that aspect of other modes. Under preservation, we have had a substantial increase in our pavement quality over the past few years based on an increase in our investment level. And this was something that came out of the 2004 plan when they looked at the system and realized, geez, our pavement quality isn't sitting very well, and they moved some investment that way. So what you see on the in the plan now is we have a very clear goal based on our pavement quality index on where we want to be with our system. Good or better, 75% is where we want to be. Fair or better, which means 95%, which means 5% or less being poor. And a pretty aggressive goal when it comes to bridge, that we would have no bridges under our jurisdiction that are structurally deficient. And happy to say right now that's the case. We have no bridges structurally deficient on our system. So right now, I mentioned our goal is 75%. As we looked in 2004, we were at 65% good or better. And as of right now, our 2010 data, we're at 85% as being good or better. As we look at management, there is a 10-ton county highway system plan. So you'll see a map. I didn't put the map into the presentation. Roads in Burnsville you'd see on that are Cliff Road, 42, obviously 46 at the south border. 5 is not on the map right now, and I think in part probably because of how closely it parallels 35. But if that's something that the city would like to see, that's a comment that you certainly could make and we could consider as well. So, and of course 5 turns into 50 in Lakeville. So actually none of 50 and 5 are shown now as part of the long-term 10-ton system.
Craig, do you remember when Ames Construction was concerned about because some of the trucks that they have coming into their yard?
Madam Mayor and council members, yes, I do. That was a difficult issue for us. I do believe that we were able to work our way through that, but that might be something that we would want to consider, at least having certain segments of it that could be rated 10 ton.
I really would like to make sure that we do that because Ames Construction is a very significant corporate citizen, and they do have a lot of heavy equipment going through to their yard. So we need to. Cliff Road and Pepsi trucks. Is that on the 10-ton?
Cliff Road, all of Cliff Road within Burnsville is on the 10-ton planned.
Okay, and so Pepsi will, because I'm just thinking of all of our businesses that have all of these heavy vehicles that go through. And then we have yellow freight coming through Cliff, 13, 13 is a state highway. I'm just thinking of all of the ones on the county road system. So Ames, we need to make sure that we can address that issue.
Sure. Real quick, other items out of management, access guidelines that have been adjusted, tweaked a little bit. Nothing substantial. The undivided roads that are a little slower speed, now we've loosened the guidelines a little bit there. I think we're at 1/8 mile if you're 40 miles or less. It used to be, I think, more dependent on the traffic volumes, but a little bit of acknowledgement there that as speeds go down, people's ability to handle those access points. Also, if they're going slower, they can handle them a little bit more closely. So, and also some notes in there that acknowledge that access on the county road is part of a bigger system that serves accessibility in the area and also locally. So, of course, we're seeing much more, and we did on 42, things like 3/4 intersections. We're trying to get most of the movements supported, but still dealing with maybe the most dangerous movements. So a little more clarity in the guidelines in regards to partial movement accesses. And then, as I mentioned, we talked much more about roundabouts.
Just one more question. Craig and staff, yellow freight, and maybe Jenny and Skip, have we ever had any complaints about 10-ton with yellow freight? I mean, because they do have to go through Cliff in some areas, but mostly 13, do they?
Madam Mayor and council members, I'll maybe take a stab at this because I think it certainly preceded Mr. Albrecht, but I'm not so sure that perhaps DuPont isn't 10-ton constructed. Do you think I'm right, Steve?
Yes, I believe you are. Yeah.
So they do in effect have access to an all 10-ton system because they can access Highway 13 and I-35W.
Okay, so they don't have to use Cliff Road to get onto it.
Well, Cliff Road, Mr. Sorensen said is rated 10.
Rated
Is
10 ton.
10-ton.
That's
Well-
right, that's right, Olive Cliff. Olive Cliff?
In
Yeah,
Burnsville.
Madam Mayor, it's on our planned system map to be 10-ton, to be officially designated as 10-ton in the future. There's a process in the plan that explains what needs to be done. Part of it is a city council resolution, so before any of these routes are officially designated as 10-ton, it'll come back to the council. We don't have any officially designated right now, but what the plan does is, we really need to look at the whole county and how it fits in with the state system. And so that's what the plan does. It's kind of that first step to say, these routes seem to make a lot of sense. Now let's jump in and look at, okay, how were they built? Do we have issues with bridges? Do we, do we need to coordinate connections on the local system or the state system? Those types of things.
For me, my concern is our businesses.
Sure.
Our
Absolutely.
businesses who have these heavy equipment that they take through these roads. We have to make sure that they continue to operate.
Sure.
Yes, Steve?
Thank you, Madam Mayor. Brian, regarding traffic control devices, your signalization along your county road system, how often do you assess the traffic counts along those systems and readjust those traffic signals?
Yeah, so they're coordinated? Is that what
Correct.
Yeah,
Yeah.
Yeah.
I'm on your page too.
Madam Mayor and Steve, we, You know, a lot of times it's opportunity based. I mean, we certainly can't get out there just time wise, staff wise, and be able to reassess signals as often as we'd like oftentimes. But, you know, as opportunities arise, as projects move forward, you know, I haven't gotten to the replacement section yet, but as we get into, part of our aging system is our signals. And we're going to have to start to look at signal replacement. We have a couple in the CIP right now we've been working with staff on along County Road 42. I think Portland and County Road 11.
11, I was just going to say 11. You can use the yellow flashing for the left turns. We use them very well here in Burnsville. So
They're very popular. We hear that everywhere we go, Madam Mayor. That's and that is something that would be assessed anytime we're replacing a signal. So a lot of times it's opportunity based. We may be looking at just coordinating systems. You know, we're always adding coordination. You know, where it makes sense. And so it's I don't know that I can tell you it's every 3 years, but a lot of times it's as opportunity presents itself. Or as we have problems. And sometimes it's a simple call from a citizen that says, you know what, this isn't looking quite right, what's going on? And we go and watch. Oh, well, we need to do a full assessment here. We need to take some counts, and we need to figure out, is there a better way to set this up? So
great that you're here now. It's the Parkway and 11. That signal needs to be on.
Okay.
I would just add, council and planning commissioners, that our staff does meet with county staff, I'd say every 2 months on signal concerns and issues. I mean, we have 22 city signals that the county assists in maintenance, and then there's another 50 county and state signals in Burnsville. So traffic signals are a big part of our life here, and county staff is always meeting with us, and they're over at City Hall quite a bit working with our police department and other concerned residents on issues. So part of, as Brian touched on, we have an aging system on 42.
Yeah.
I think those are some of the first signals that were built in Dakota County, and the county has put together a comprehensive replacement plan for those, and so we'll be working with the county as they upgrade those signals.
You know, and Steve, to your point, they did a nice job when they reconstructed 42. So traffic in the morning, I haven't heard one complaint from because it was moving. You know, they were hitting all of the, it was timed right, and they were hitting all of the green lights, and also on those peak hours. So you're absolutely right. When they're timed right, the traffic flows well.
It can make a difference.
Yes.
Absolutely. I was going to add one thing. I think this is where maybe I should, under management, we have the jurisdictional potential changes map. Steve referred to talking about County Road 42, and there's some language in the document, not unlike what you would see in other documents, that says, you know, generally functional classification should match with jurisdiction. So if you're looking at principal arterials, typically those would be the roads that would be on the state system. Minor arterials, maybe collectors, you're getting more into the county, and with the cities might have some minor arterials, but a lot more collectors and local streets. So we show a map that says between the county and the state, if we were going to meet that objective, here are the roads that would fall into that. And of course, 42 falls into the category as being a potential county to state jurisdictional change. Early in this process, and I mentioned we had multiple board workshops with our county board, we had this discussion with our county board, and I can tell you the county board had no interest in talking with MnDOT about any jurisdictional change with County Road 42. And so it's really in the context of it's in the plan in the context of, if we were to carry this out in the long term, these would be the routes to consider. We have no plans to discuss County Road 42 with the state.
And I'm going to go to Mary, but I want to make a comment and thank our staff for making sure that 42, we experience 13 on an ongoing basis. They're lousy at maintaining that asset. Lousy. They can't even mow it. They can't keep it. So, and for us, we have all of these people who come from all over the world to Goodrich. And what I hear from them is that we have to make sure that we look good when their clients, their customers come in. And they come in every week from all over the world, from France, from China, from Japan, from wherever. And I know when they're going to have a large contingency, I call Commissioner Workman. And it needs to be mowed. And I don't have anyone at the state level that I can call and say, come and mow this, because they don't listen to me. And so, thank you, Steve. Thank you to our staff to making sure that you understand that it's important that, we have access to the county when we need to make sure that the roads are maintained well and the boulevards are maintained well. That's within your jurisdiction. We do our job, but we need to make sure that that's kept. Mary.
Well, that's essentially the point I wanted to make, but it goes way beyond Burnsville. I sit on the Economic Policies Committee for the League of Minnesota Cities, and even small outstate communities are just go absolutely wild because this state does not maintain their right-of-way. And as the mayor pointed out, I mean, we have very important economic interests. I think every community does, to have those maintained. But I get a little nervous knowing that it's somewhere.
In the plan.
You bet. Because if it's anywhere, I don't like that. I just don't like it. If there's no intent, then why have it in there?
Yeah. We would submit that you remove it. And I think if the county commissioners, what did they have to say? That they would say, go ahead and leave it in there? Because I would think that they do not want to have that language in there if you have because I'm looking long-term.
Yeah, I think we probably, Madam Mayor, we're trying to look a little more globally. We weren't focused in so much on 42. We were trying to look countywide and systematically. There's a number of roads.
Yeah.
There's a number of roads on that map.
I would think Apple Valley would not like to see that because in Lakeville, any of those cities, and Egan would not want it also, that have a lot of economic development. Yeah. So Mary and then Steve.
Well, I hear when you say looking globally, but if it's not going to happen, it shouldn't be on the globe.
Yeah. Okay, Steve.
Thank you, Madam Mayor. Brian, has Scott County shared this sentiment regarding County Road 42?
Yeah. Madam Mayor, that's a good question. I'm not sure how their plan depicts it. I know from being there previously that the previous transportation plan did show it as a potential jurisdictional issue. And again, left it at that. It never really spurred any discussion at the time. And I would guess, not knowing offhand, but I would guess Savage and Prior Lake would probably feel the same way from what I'm hearing from Burnsville. So it's more just an indication that, and it's a bigger issue because when you look at MnDOT's system, they've got a lot of roads on their system that they probably shouldn't have. And that might play into the issue of, maybe they'd put more attention into Trunk Highway 13 if they didn't have to spread themselves so thin on all the state routes that really set up more like county roads. So I guess that's more the flavor of what we're trying to depict in the plan than it is to say, we're going to leave the door open on this just in case somebody gets an idea and wants to start talking about it.
Well, Brian, as that goes forward, and with County Road 42 being a principal arterial and carrying as much traffic as it is, and being such a reliant section of roadway for not only Dakota County, but Scott County and other areas in the region, are we potentially causing ourselves some problems in terms of competing for funding if we're not considered as part of the state's, or having that roadway part of the state system, and MnDOT not seeing it as importantly as we see it?
Yeah, Madam Mayor, that's a complex question. We've got, there's a number of funding sources that we probably, MnDOT obviously has more money at their disposal, but where 42 ranks on the list, it would be very low. So, 42 then, therefore, because it's under our jurisdiction, we've probably been a little more aggressive in trying to go out and get outside funds. 42 Segment 8 would not have moved forward without federal funds to help us with it. It probably was easier for us to fund because the county and city were there making it happen. I'm not sure if it makes it eligible for more. I think MnDOT probably could have done the same things that we did to make it happen, but
They
the
can't
reality
make
is they
13
wouldn't.
happen for us. So, yeah, I'm going to go to Councilmember Coughlin and then Dave.
Excuse me, Brian. I still don't know what the answer is, because the question she posed is, why is there a joint jurisdiction? I saw some input, but I still don't understand why it's there. At least you have not answered the question of
Well,
my.
Madam Mayor, I think part of it is the context that it is in the plan. It's part of looking at countywide, if we were going to align functional classification with jurisdiction, these are the changes that would be made. So if there's a way, if the city feels there's a way we could clarify that better in the plan, either through the text or the map or the title of the map, we would be open to that. It's something we could talk about further as far as pulling out. It's probably getting more attention here than it deserves, and it's not going to change in the next 20 years. So, at the risk of, at this point in the process, going out and completely changing a map, which could have other implications, maybe it's just the context that it's presented.
I'm going to go to Dave, and then I have some comments that I think that would help us with the language because it has to do with economic development.
Yeah, on the jurisdictional, is the jurisdictional language, does it work in the reverse? We talked about a county road being converted to a state, going to state jurisdiction. Is the jurisdictional language necessary if there's a road that's a state road that is going to become a county road? So I guess there could be a reverse benefit with that same language, understanding the concern going from county to state. I don't know if that is true or not, and if that would ever happen, or.
Well, absolutely. I think one of the comments we received was, well, geez, you're showing a lot of state routes that could become county roads, many more miles. Does that? Well, if you look at our full plan, we've got a lot of county roads that also really should become local roads. They don't serve a county function to the degree that they serve local functions, and typically what I'm talking about here are rural county roads. And if you look at that part of our jurisdictional plan, we've got a lot more county roads that would need to go local than currently local roads that should come up to the county system. So yes, we're trying to look at it system-wide. We're looking at it in all directions, and we're trying to lay it all out in the plan, kind of in an integrated fashion, and to I shouldn't say arbitrarily, but just to pull one out for good reason, just to pull one out, then I think we'd have to add a lot of text in the plan explaining why that is. Which, we could do. I don't want to create more angst where we don't need to. We're just trying to have a fully comprehensive planning document.
I wonder if one of the things that we could explore is economic impact of county roads being transferred to a state system. Because that, to me, is what we're talking about, is the economic impact of a county road going to the state, and the state not having the resources to manage that asset.
I think that's fair, and that's something we could add to the document, that is the case. I think it would take a lot of analysis and assessment to figure out exactly what that would be for 42, and it's, some of it we don't know, and we don't totally understand where it would fit on the system if MnDOT was faced with pressure to move forward with the project. But do we need to go that far with a planning document that's trying to look kind of up here at this level, I guess would be the question.
I think for us, and I again credit our staff for really looking and really making sure that our sentiments are expressed, and Steve really did that well. But the thing is, it is a planning document, and when you're looking at economic development, we're looking also at a 50,000-foot level, long-term. And when we understand that the state doesn't manage their assets well, and it has an economic impact on 13 for us economically, that's a problem. And now you've got north of the city, that's happening, and now you come to the middle of the city, and that gets transferred to the state, and that's going to happen, it's going to have a very, very dire impact in terms of visual appeal. Yeah, Craig?
Madam Mayor and council members, perhaps council may want to direct the staff
Staff,
to
yes.
prepare some suggested language to reflect the concerns that perhaps
been
the county
mentioned.
could include in the document
Yeah.
to raise the elevation of this concern.
Yeah, and I
Yeah.
think that was our goal tonight, was to, I think staff thought that the council would have these feelings because it's an important issue, and I think we wanted to make sure before we sent that comment in that we had full support of the council that was the direction we want to go, because that's something we need, that Brian needs to be able to take back to the county commissioners and to the county engineer and put in as they evaluate the plan. So.
Mary, do you want to make that?
Yes, well, I definitely support that, but I also want to say that up to this point, I've been very excited and very, very pleased with what you've done so far. I mean, I really think that you're really looking forward. You're looking, you're trying to look around the curve, so to speak, and that your policy changes and the goals that you've set out here all reflect that. But this is a curve I don't want to go around.
And I understand everything that you as engineers look at on a transportation level, and I think Steve's and both Steve's, we all know that you will always look at the utilitarian aspect of that plan from an engineering's point of view.
Right.
Now, when you come to elected officials and our city manager and some of the other folks here, now we're looking more globally on the impact of just the transportation system in terms of the economics, vitality of our city, and the visual appeal.
Sure.
And understanding how other jurisdiction works. Now we're saying to the engineers, yes, on that 50,000-foot level as well, here's the other factors that we see impacted.
Sure.
So we'll have our staff begin to put together some language that we can send to you.
I appreciate that. That will be helpful.
Yeah.
It's okay if I keep.
Absolutely.
I'm gonna try
And
to.
doing a very nice
Gonna
job.
try to fly.
We some signals.
Yes.
But this is the biggest.
Very clear.
Yeah.
Yes. I'm gonna try to, and I know I've probably chewed up all of MnDOT's time at this point in addition to my own, but I know you've got other items on the agenda, so I'll keep moving. I talked about replacement, the replacement needs, and of course, all of our facilities have a lifespan, and we can preserve and we will preserve as best we can our facilities. But at some point, the preservation investment doesn't provide the value back, and we need to replace it. This is an indication of when we look county-wide at the age of our roads. So the darkest color here is the oldest, so they would be 75 years or older at the end of this plan. There's a substantial amount of about 117 miles worth of county roads. Can roads hold up for 75 years? It's a complicated question. Oftentimes the answer is no. When it does fall apart, though, is a function of a lot of things that we don't necessarily have control over. And of course, we will manage those corridors on a case-by-case basis and try to stay on top of them and make the decision at the right time for replacement. But as you look countywide, of course, it's the rural area. When you look at the communities like Lakeville and Burnsville and Egan, of course, we're not seeing much here for age. And this, we're seeing now, of course, we've had to expand our system to keep up with the growth. A side benefit of that is we've bought some time with those roads. And those roads will hold up now for a while. In the parts of the county where we haven't been able to make improvements due to a lot of times other needs like expansion, that's where those roads are going to need more attention. They certainly are for preservation until they hit their useful life, and then we're going to have some pretty sizable needs when it comes to replacing those roads over the next 20 years. Improvement and expansion congestion based on growth holds steady. So when you look in the plan, I'm not showing the congestion map. It looks very similar to the congestion map as far as overall expansion needs in the county. to the map that we showed in the 2004 plan, which is good news. I think that means we've kept up through a lot of effort between the county and the cities to keep our system where it needs to be. We did take a quick look. People are interested to know at potential another Mississippi River crossing. We've got a substantial distance between the Wakota Bridge, 494 Bridge in South St. Paul, and then Hastings. And if we do add a lot of the growth, especially Egan, Rosemount, Farmington, Hastings are all showing growth. We wanted to look at is there going to be benefit to adding that? And ultimately, the volumes that were placed on that road through our modeling efforts didn't justify a plan for another crossing. And if you're familiar with that section of the river, but it'd be a pretty tough place to cross, which is probably the reason there's no bridge there today. It's not an easy place to get across the river, so it'd be very expensive. And so it was pretty clear to us, based on the potential benefits of that connection, that we would never get value out of planning for that type of crossing of the river. Good news is there, Wakota is newly improved and Hastings is being improved as we speak. So those bridges should hold up for a long time to come. We do show a number of future county highways based on planning studies we've done over the years. And we have a number of studies we're going to be looking forward to. And just a couple of the big blobs you're seeing here, the pink and the green blobs, are principal arterial studies. So we've been through this with 42 in Burnsville. I think as we look forward, we'd like to have a plan for principal arterials in the long term. So as growth continues to happen, whenever that is and wherever that is, we know what these roads are going to have to handle from a regional standpoint, and we can plan accordingly. And hopefully we can kind of minimize some of the long-term investment that needs to be made through good planning. So we'll be looking both north-south at our system, where we've got Cedar, that's a principal arterial starting at 42. South of there, it hasn't really been planned as a principal arterial. You got to go all the way over to 52 before you get a real functioning principal arterial. What this has meant for our system is the county roads have kind of become de facto principal arterials in part. If you sit on Pilot Knob during the peak hours, it kind of looks like a freeway in the nature of the traffic. It's very heavily peak and directional. So some of our county roads that serve us very well in the communities and doing the things we need them to do within the county also serve bigger functions. And we want to be able to plan for that in the long term. So that's what those types of studies would do. So this draft document is on our website as we speak. You can, if you go to if you Google Dakota County and you type in search 2030 transportation plan, make sure you put 2030 in, otherwise the old one you might get that link first. Then this document is all there for anyone to go and read. We did have a public hearing on December 13th. We are assembling our responses to comments such as Burnsville's right now, and we're preparing for a formal submittal to the Met Council of our plan. They also want to see the comments and then what our responses would be to those comments. So once we get back formal approval from the council, that'll go to the county board for adoption in probably going to be March, I would guess at this point. Did we cover?
Anything else, Steve?
Thank you, Madam Mayor. Just a couple of quick hits for you, Brian. I was wondering if you could just provide us with just a few updates, whether there's any other types of BRT or LRT that's being considered by the county in the long-range planning, and if there's been any talk, regardless of what the state of Wisconsin is doing, regarding high-speed rail and the potential impacts in Dakota County for something like that coming through.
Right, Madam Mayor, we are just about set to begin on an alternatives analysis for the Robert Street corridor, which actually will include an assessment of Trunk Highway 52 as a potential transit corridor option. And they'll be looking at.
Is that the connection to Rochester, Chicago for high speed? Is that what you're talking about?
This, Madam Mayor, this will be that's the high speed is different. This alternatives analysis will look a little bit more locally. There's been a lot of question about how to integrate transit along Robert Street in West St. Paul. And tied also a little bit, even as far out, I mean, Rosemount continually is planning for transit and would like to see more transit. And as we look even south there to the Umore area, where Umore's got, they at least have a long-range plan to put potentially 30,000 people. It's almost like plopping another suburb right in the middle of Dakota County. So there'll be some considerations for that but that's as far south as that alternatives analysis will go. But they'll be looking at a number of options. I think LRT is on the table, BRT, streetcar. They'll be doing some assessment of those options as part of that process. The high-speed rail, I'm probably not the best to answer to that. I know our transit group is engaged with that discussion. I think it's touched on very lightly in the plan at this point. And I could get you
plans on where that can go, that high-speed rail. What St. Paul is supporting and what the rest of us is looking at in terms of connecting Rochester to the university and to the airport and all the way to Chicago.
And I could have someone follow up with you, Steve, if you'd like.
That'd be fine.
Okay.
And then, has there been any interest at all in dredging up the Dan Patch LRT at all? It's close to where I live, so I'm just curious.
Madam Mayor, we've had no formal discussions on that at this point. I think there's been legislation that at least opens the door.
They're trying to open the door again.
Right.
Yeah. It has to go to the legislature to open that door. Craig, at the MLC legislative, when the city managers are getting together, was there any conversation of how that's going to open up? Because I know that conversation has been closed down by the legislature.
And Madam Mayor, I think prior to a couple years ago, we would have all been put in jail for thinking about that possibility. It was illegal to think about that. But that ban has been lifted. We can now think about it.
We can think
do
about it,
anything.
but we can't
We
talk
can't think.
about it yet, can we? We can think about it, but can't talk about it yet. Yeah. Brian, first I want to thank you for all of your work and effort for 5 and 13 for that intersection. Thank you very much for all of the work that you've done to help us, and you and Steve have been working very hard, so we're going to see that work moving forward. So I want to thank you for that, for all of your efforts in facilitating and making sure that we get that work done this year. And so thank you for.
And Mayor, as you know, we're very excited about that project, and that project will get underway this fall, and I know the city shares that sentiment with us, and
It's been a long road.
I can't take a lot of credit for it. Of course, John Sass from our department is our project manager, and he makes everything happen there. He gets the right people talking about the right things at the right times, and this project will happen in large part because of him. And then we also need to mention Ryan Peterson, because Ryan's efforts have been phenomenal through this process, and I know you know that, but we recognize that too at the county.
Very good, thank you. And so thank you for what you came to present to us, and we appreciate your listening and our concerns about 42. And Steve, I want to thank you and your staff for all of the wonderful work that you did in really combing through this plan and seeing the areas that are going to be impactful to Burnsville in a negative way. So thank you very much to you, Steve.
Thank you for having me.
Thank you for coming. Great. The next item then on our agenda is the update on the Fire EMS Community Paramedic Grant application, and our Deputy City Manager, Tom Hansen, is going to present along with our Fire Chief, B.J. Jungman. And so excited about hearing about this wonderful new model that can be implemented. Hopefully that, thank you so much for coming. Thank you for joining us. And hopefully that this is something that we can replicate throughout the country. Tom?
Madam Mayor and Council, this is a really interesting idea. Typical with large grants, it seems like they always come to you with a deadline that's about 3 weeks away. Doesn't matter if it's $1 million or 50,000 or 10,000, we need the application now and hurry up and get it in. Well, this was no different, and Chief Jungman and Assistant Chief Carlson, 3 to 4 weeks ago, found this particular grant opportunity from the Center for Medicare and Medicaid Innovation. And it's a grant title that actually is quite in keeping with its goals. And I think Chief Jungman and Assistant Chief Carlson have an extremely good idea here, but we felt it was quite necessary to run it past you because of the sheer magnitude and potential long-term implications of it. So without further ado, I'll just ask Chief Jungman to take it from here.
Chief?
Madam Mayor,
Assistant Chief, it's good to have you here. Welcome.
Madam Mayor, members of the council, thanks for having us. We're extremely excited about this opportunity. It could be changing for healthcare in the nation, actually, with some of the ideas that we've come up with, we believe. So just kind of a quick rundown is the Healthcare Innovation Challenge came from the Center of Medicare and Medicaid, so from the federal government, and they have allocated a total of $1 billion for improving patient care and reducing healthcare costs. And what they have available is between $1 and $30 million grants, somewhere in between there. So you have to apply for at least $1 million, no greater than $30 million, and that covers a period of 3 years. It's a very ambitious timeline. The submittal is due in a week and a half, and it's a quite extensive application because there are a lot of unknowns because we can innovate and kind of create what we want out of the grant. They also have an ambitious award schedule. We will find out by March 30th whether we are awarded or not, and they would like the implementation within 6 months of the award. So, very ambitious. Basically, what we propose to do with this grant is to use funds created from to create a fire-based community paramedic program in the state, and it'd probably be the first in the state and perhaps in the country. And just to give you a little background, last year there was some legislation passed to allow community paramedics in the state, and we're one of very few states that have it in legislation. And I'll kind of do a quick rundown of what's the difference between a standard paramedic and a community paramedic. We currently have 37 paramedics in the department, but none of them are community paramedics. Again, that was just established last year. So our standard paramedics are very good at responding to acute illnesses and traumatic injuries. So they do very good taking care of heart attack patients or car accident victims, all that kind of stuff. They're great at what they do. What we don't have a lot of background in going to paramedic school is the community health piece of that and kind of the preventative health piece of that. And that's what the community paramedic is really about. They go back and get about 350 hours of additional education, and they are specially trained to monitor and assess primary care and ongoing complaints. So patients that have chronic illnesses can now be evaluated by a paramedic, and they will talk with their primary care physician, which we currently don't do. You know, currently we go pick people up and we bring them to the emergency room. That's really what we do. And what this allows us to do is integrate into that healthcare system a lot better, work with their primary care physician, work with their specialty physician, and work through any issues they're having without just automatically bringing them to the emergency room. And also on a preventative basis, do some simple procedures. We can do EKGs for them in the field without having them go to the doctor's office, provide vaccinations right at their home or at an apartment complex or wherever that may be. They can operate individually, so they don't need to be in teams of 2 like we do currently. Obviously, going to an emergency scene, we need 2 paramedics to make that scene function and to take care of the patient appropriately. With this, we can send 1 paramedic out to go do a wellness check on someone in their house, make sure they're compliant with their medications, making sure that they're not having any recurrent issues with their chronic illness. But again, it's basically to help coordinate that care and make it more effective, with the goal of reducing readmissions to the hospital and recurrent visits to the doctor's office. So kind of what benefits do we have out of this? Basically, we want to reduce the readmission rate to the hospital, which obviously will reduce costs to the overall healthcare system because it's going to the emergency room obviously is the most expensive way to take care of your illness. And we do have a lot of people that tend to use the emergency room as their primary care clinic. So if we can get ahead of that before they call 911 and either direct them to primary care or assist with primary care at their residence, we can maybe prevent some of those ER visits. Reduce unnecessary emergency room visits, again, those things that they're using the emergency room for primary care. Improve community health, so if we can provide vaccinations, fluoride treatments, things like that that people currently aren't getting through an outreach program like this. and reduce EMS repeat responses. So we have some super users, we would call them, within the system that call us frequently.
Yeah.
And if we can go out and visit with them before they call 911 and reduce, again, that ER visit and take care of their chronic illness before it becomes so bad that they need to go back to the emergency room. Again, the benefits, reducing the total cost, reduce direct time spent by accountable care organizations or healthcare systems. That's kind of the buzzword out there, is accountable care organizations, and that's part of the new healthcare system is these organizations. I know Fairview, being one of the large ones in town, has applied to be an accountable care organization, and it has to do with how they're being reimbursed and paid for their services. Our community paramedic model is flexible to suit individual patients and situations, and our community. The nice thing is it can change over time as we go forward. The community paramedics are taught on how to assess the needs and the gaps within the community and basically address those. So if we have changing needs within the community over time, our paramedics will be able to address those. Brian and I have created quite a partnership going forward here in a short period of time. We've had great partners in the community and the healthcare system, but I think we've created some long-lasting partnerships moving forward. And I've listed a few of them here, but I think Brian would agree we've got more than that. But Fairview Systems, Dakota County Public Health, they're 100% behind this. Dakota County Crisis and Social Services are very well behind us on this. The Burnsville Savage School District, local businesses such as senior care facilities and elderly care facilities, primary care physicians. Again, all those kind of have a piece of the pie here to help us make this functional. And the services we can provide with this grant is community medical assessments, discharge following. So if someone gets discharged, there's research out there that shows if we can go visit them in their home within 24 to 48 hours, make sure that they got their medications, their house is safe, they tend to have a lot less occurrence of readmission. Health screenings, immunizations, repeat following and care plans on chronically ill patients, home safety evaluations. You know, we've got the expertise. While we're there, we can check their smoke detector, make sure they have a fire extinguisher, make sure that they're not at risk for falls. Basic medical procedures such as replacing catheters, doing EKGs, lab draws, fluoride treatments. Those are just to name a few of the things we could provide.
Mary.
How would you be compensated for your work? Or is this part of the grant?
This is part of the grant. So initially we wouldn't have that, but what we're working towards in the legislature this year, there's some legislation up there to equate the community paramedic with standard reimbursement codes. So the ICD-9 and 10 codes, which is a technical term for how they bill treatments. So we would if people that have private insurance in the future, we would be able to bill directly to those. Those that don't have insurance is where it becomes tricky, and that's where accountable care comes in. We believe in the future, if there's accountable care and what's called bundling patients, that it's in the best interest of accountable care organizations to keep these folks out of their emergency room. It's kind of counterintuitive. You know, you think that hospital want more business, but if they're not getting paid for the business, we think there's a financial impact that if we can prevent them from coming, they might have a financial interest in reimbursing us for doing some of these services.
Yeah, and just
Marion and
Bill.
Bill.
As a follow-up, if our community medical, what do we call them now?
Community paramedics?
Community paramedics are on a call and there is a more dire need for services of our fire EMS, what happens?
So they would then leave the non-critical service they're doing and come back to it. So the things that are outlined in this grant are the non-critical functions, but they're able to provide that surge capacity in the event we get busy or have a significant call that they need to go to. So they would be able to break free from the service they're providing that's non-emergent and provide the emergency service.
I knew you had already thought about that, but I just wanted to hear it.
Okay. Bill and then Tom.
Well, I just want to go on the record. It sounds like a good idea, but once assume you got the grant and once the money runs out, I just want to give a heads up that unless I saw that it would pay for itself, it then will become another cost to the city. And I wouldn't accept that. And I can tell you from conversations with Fairview Ridges, they have a significant unreimbursed ER room that is putting a dent.
It's a big strain on their revenue.
Big strain. So, and that's something we would not as a city want to take on, again, unless we were somehow fully compensated. And separate from that issue, we'd also like to hear from some of the primary care providers. Some of that is, in private enterprise by Quello Clinic or others provided by some of the clinics. And I'm not saying there's not a need and that if a grant is provided that it's not a good idea. I'm just throwing those other issues out.
Good point.
Yeah, Tom.
Actually, I was just going to follow up real quickly on Mary's comment, and that this grant would actually cover all expenses for 3 years. But after that, to get to Councilmember Coughlin's issue, there would have to be a decision made, is this of value to continue or not? And that would be a crisis point.
Yeah, and the thing that I have also been exploring, because this is a Medicaid, Medicare, and so I know that when we do emergency service, it is also billed to the third-party payer, correct? And also to Medicare, either to their insurance or to Medicaid.
Correct. Yeah, we do bill Medicare and Medicaid, and then if they do have a secondary insurance, we will bill them, but we can't collect the remaining from the patient.
Yes, so I think we have to, and I was on the same page as you are, Bill. Okay, so we're going to have the grant, but again, in the third year, how do we sustain? And I'm always looking at sustainability. How do we sustain the service moving forward? And it's an impressive group of partners that you have. But those are the three pieces that I see, is a third-party payer, Medicaid, Medicare, and that we can also look at in terms of, will we be fully reimbursed for that?
And just one other note along those lines. Recently, one of the major healthcare providers thought they could create a clinic that would be provide similar benefits and be self-sustaining and actually pay for itself with Medicare, Medicaid reimbursement, et cetera. And they came to the conclusion, at least according to the newspaper Tribune in the last 6 months, that they could not create that model because, of course, Medicaid and Medicare for more minor procedures, at least for health clinics, et cetera, reimburse at less than cost. So again, it's a great idea. It just will become a very, very significant issue at the end of that grant period if, in fact,
Craig.
we get it.
Madam Mayor and council members, as Tom and the chief described this to me, they stressed that this is a pilot program, that the Medicare and Medicaid folks are willing to invest in this because they don't know the answers. And at the end of the 3 years, the fellows may conclude that this really doesn't work, that this doesn't affect the savings to the systems that we believe it has a chance to do that, and at which time we may be out of this business. But in the meantime, I think that it's got some terrific possibilities, and it would be explored at no cost to the city.
Yes. The thing that I also see while we're going through this exploration and building a model is that at the same time, we can concurrently look at how this can be self-sustaining by looking at how it's going to be paid for through a third-party payer, through Medicaid, and whether, because to your point, Councilmember Coughlin, when you're looking at a clinic, you've got some high investment in the personnel that are there. That doesn't mean that that's not a high investment that we put into the personnel that we will be having trained. My question is that, is it going to be using the same personnel that we have, or are we going to be adding more personnel? Or are we going to expand what our paramedics, the standard paramedics know now, and a segment of them doing community as well? So we're using the same pool, only a little bit more expanded in their knowledge base.
Yep, Madam Mayor, I have a couple of slides coming up here.
Oh, well, we're just jumping the gun on you. We should have just been patient. Okay.
And actually, it's my next couple of slides here. I just wanted to, just currently where we're at for resources. So we have an all full-time staff. We staff 2 fire stations. We staff an engine and an ambulance at both of the fire stations, and we have 37 paramedics.
Okay.
Currently, obviously, the fire chief, 2 assistant chiefs, an administrative assistant, a fire marshal, a fire inspector, a training officer, and then 3 shifts of 11 firefighters. They work the 56-hour-a-week average. 2 captains, 2 fire motor operators, and 7 firefighters per shift. And what this would do is we would be looking for the grant to fund 3 additional firefighter paramedics and 1 captain paramedic, an administrative assistant, a new ambulance, a response vehicle, 2 additional sets of paramedic equipment, and the community paramedic training for the 10 staff members. So not only would the 4 staff members that are directly providing community paramedics, we'd also expand the scope of 6 additional staff members that are currently working our suppression system on shift. So we would need to add additional staff to be able to do this, because the staff we currently have aren't able to carry that additional load with what we have. But in return, we'd be able to pick up a lot of those additional medicals when we do get busy, instead of calling mutual aid ambulances.
Okay, Mary.
I don't want to get too far in the details here, but where would you keep those additional vehicles? I mean, do you have room?
We would probably have to do some shifting of resources in the event that we did that. Working with Mr. Bussey down at the shop, maybe to keep our reserve ambulance or something like that there. We'd have to logistically figure that out. These folks would not be on 24-hour shifts, so it might be a little bit different. We could have a different report to work location and things like that, because they don't need to. They wouldn't be staying overnight. Benefits to the city of Burnsville, we'd have better firefighting capabilities because we'd be adding 2 people on probably around 10 hours per day, approximately. Improved service to our community, leverages on training and experience of the current firefighting personnel. We reduce the system burdens of the emergency ALS system by adding an additional ambulance. So when we do get those additional medical calls, we can take those 10 hours out of the day. Reduce avoidable hospitalizations for our citizens. And obviously, as policymakers, we want you involved as we go forward looking at this.
Okay. Is that the end of your
That's,
slide?
I'm sorry, that's, any questions?
Well, I can tell you that it sounds to me, when it looks at prevention, and I think one of the things that if we're looking at an aging community and we're looking at trying to reduce healthcare costs on a global level, and I'm looking at Burnsville by itself, that and the community health piece, because I've gone out on ride-alongs, and I think on the 2 ride-alongs that I see that we get to the same house for the same person for the same incident, and 2 different years, and yet, so that for me is one of those folks that we're continuously that continuously call 911. That would probably reduce some of those, and I'm sure that we have quite a few of them.
Correct.
And so I think that would also help. And the goal of reducing readmissions will also help our hospital, but also help our citizens. If they can be healthy, then they wouldn't be able to do that. But again, the issue is after the 3 years.
Correct.
Yep. And I think at that point, we can work concurrently to look at how we sustain this. Because any time I always look at, whenever we're going to do something new, how are we going to sustain it long-term?
Correct.
Yeah. Craig?
Well, Madam Mayor, and trust me, the last thing I want to do is to say that there are difficulties here. But I'm not sure that we will sustain it, or that the pilot will even show that we should sustain it.
Yeah.
I mean, I think that's what we will learn in the 3 years is there something here to be gained or not? And at the end of it, we may simply say, well, we had 3 years of some extra benefits to fire, because Tom calls this the bigger flywheel. We may have had some benefits for 3 years, but at the end of the 3 years, we may say, there really wasn't much to be gained here. We didn't affect some of the gains that we thought we would, and it may be very clear that we don't continue at that time.
Okay. And Bill, and then Mary.
So have you costed that out per year? So you're estimating it's roughly $333,000 per year, that proposal?
No. We can apply for anywhere from 1 to 30 million, and with all the capital expenses, we're right around 2 million somewhere. We haven't gotten all the final costs in that we need.
There's some one-time costs, like for the vehicles and all of that, but it's the personnel cost on an ongoing basis.
Right. And then are you going to factor in that if we come to conclusion it's not a cost-effective deal, that whatever layoff costs or termination costs, you're going to factor that in as well as part of your proposal?
That is correct, yes.
Okay, Mary?
I think that in concept is really a great idea, because I look at medical care, whether it be emergency or not, as something that we really have to think of new ways of delivering. So this is very appealing to me. But as Bill pointed out, that question of what do we do after 3 years, now I started thinking about the presentation we just got from Dakota County Transportation, and that is that if it's in there, it doesn't tend to go away. And so that's my final point is, as you're doing this, I would like to see how you're going to measure what kind of data are you going to try to gather to show whether or not this is truly worthwhile. And I don't know how you do that. I don't have any ideas. You're the ones that can figure that out. But I think that if you want to continue it in 3 years, you're going to have some really solid data to say, yes, this is saving money for the community, long range, not just the community of Burnsville, but wherever.
Madam Mayor, if I could just add to that, we've actually thought along those very same lines.
Oh, good. Okay.
And one thing that I think we're going to be spending a lot of time on, assuming that this goes forward and we do actually get the award, will be revenue recaptures of all sorts. And to come back to you, not just with a qualitative analysis of, okay, we've done this and this and this, and that's great for medical costs and for society. This is a great model. But going forward, if the council decides after 3 years that they want to go forward, and here's the revenues you can count on, and then you make a value judgment if it's worth it or not. The very first thing we talked about when they came to my office not too long ago was the same thing you're talking about here. What happens after 3 years? The last thing you want to do is put citizens of Burnsville in a position where it's hard to say no.
Yeah, that's it. It's hard to.
And I think that the chief is fully aware of that, and those kind of measurements, I think, need to be on the table early. You can look at them and touch and feel them, and then have a very objective basis to make a decision at the end of 3 years.
Yeah.
Well, I was just going to say, at risk of probably using a bad metaphor, we got to figure out a way to pull the plug if we have to,
Well, what I had down here is, we not only do we have, if it is a program that is viable and is of great benefit and it is something we ought to be doing, you have to have a sustainable strategy then moving forward with all of its revenue sources. If it isn't, then there has to be, in a business community, we call it an exit strategy. How do you exit the program in a way that everybody understands? So that in any plan going forward, here's how it's going to be, and if it doesn't work well and it isn't a viable program, how do you exit? So 2 points. Craig?
Well, Madam Mayor and council members, the Councilmember Sherry's observations about the need for very clear documentation on this fit directly
With the-
in with what the grant
Grant is asking.
intentions are, because, why would Medicare come and give $2 or $3 million to the city of Burnsville? The only reason that they would possibly do this is that they think they're going to learn something. And they may learn that this is a terrific idea, and they may learn that it's not such a good idea. But if we will have to provide the details, and by the way, the grant will have to provide the manpower to prepare all of that analysis to show whether or not this was a good idea or not. So, the fact that we include that, as Tom and I and BJ talked about, the fact that we include that kind of effort in the program will strengthen our grant application, we believe, because then we'll be able to show to Medicare this was a good idea, or you might think this is a good idea, but it's not.
Yeah. Good. Okay, very good. Are you all right
Supportive.
with
Absolutely.
staff going forward?
Yeah.
Because right now, it
Yes, just with a comment, I hope, among other things, that you go talk to Fairview Ridges and some of the local clinics about the collectability issues. There's some major hospitals that I'm aware of, not ours, but some major ones that are in serious trouble financially because of all the unreimbursed co-pays, deductibles, and flat-out uninsureds. And I certainly wouldn't want, again, just as a little side comment, that we have to get in, it's one thing to do emergency seek reimbursement for emergency processing, but it's another to try to seek reimbursement under all those various insurance issues on the more minor procedures.
Madam Mayor and council members, we've actually had a meeting with the president and vice president of the hospital discussing our ideas with this, and we need to have some more discussion, obviously, moving forward. But some very interesting discussion because they mimic exactly what you're saying, is that they do have a high percentage of unpaid that,
It's a very serious problem for them right now, and more other
On the
hospitals.
emergency room side.
Right. Yeah, it's a 1.2 million a month, I think.
Okay, and I know that you have, I mean, in a short time, the stakeholders and the meetings that you've held is impressive, so thank you. You've done a huge amount of work in a short time to put this grant application forward, and also all the meetings you've had. Wonderfully done.
Thank you.
Great.
Thank you for your time.
Thank you, and good luck.
Thanks.
Okay.
Yeah.
Okay. And now the next item on our agenda is the sustainability update that's going to be given to us by Steve Albrecht, our Public Works Director, and Sue Bass, our Environmental Specialist. So, good to see you, Sue. You've been working hard on making sure that we can sustain a lot of things, and I love the interconnectedness now with our infrastructure and so forth. So, who's hitting it off? Steve?
I'll start off quickly and then turn it over to Sue. Madam Mayor, members of the council, what you have before you tonight is we're going to discuss a little bit of an update on sustainability, and Sue will take you through that. And then we're going to talk about our sustainable infrastructure policy, which is really a guideline for city staff moving forward on how the city of Burnsville is going to approach sustainability. And with that, I'll turn it over to Sue, and I'll be back with you in a few minutes to talk about the policy.
Okay, thank you.
Thanks, Steve. Madam Mayor, council members, I'm just going to give you a few highlights of what happened last year. I'll be doing our third annual sustainability report for the PNRC in March, and then we'll put it on the sustainability webpage for everyone to see, and that'll be complete. But we'll just go over a few of the things. In 2011, the city of Burnsville used electronics to reduce waste and increase productivity. You're aware of some of these things, the agenda packets, correspondence, bi-weekly monitoring reports were converted to electronic delivery, saving thousands of pieces of paper every month. The same with the new software for the building permits, inspections, licensing, and planning development applications. That's also saving an enormous amount of paper. So that's resources and financial savings. City staff work with members of the community to maintain healthy forests, removing 445 cubic yards of buckthorn through the neighborhood buckthorn pickup program.
Say that again, 400 and how, what?
45 cubic yards of buckthorn, and sold more than 2,800 native plants at the annual tree and plant sale. And then worked with the Burnsville High School environmental science classes to help restore native vegetation in 14 acres of Kelleher Park. The zoning ordinance for the wind energy conversion systems, that was updated to allow energy systems as accessory uses in all commercial and industrial zones with a CUP. And then, thanks. The city has continued to promote improved water quality practices. Hosted Blue Thumb program. That's working with the Dakota County Soil and Water District, and that was attended by 29 residents. We gave out water quality grants to homeowners, and that resulted in 7 rain gardens and 1 shoreline restoration, and then installed 17 rain gardens at various locations within the city right-of-way. The city has provided sustainability information to city staff, to residents, to businesses. In October of 2011, Dakota Valley Recycling hosted a green business workshop, and there were 46 participants. So with that, the other thing, we developed a draft sustainable infrastructure, and Steve will talk about that.
Thank you, Sue. The sustainable infrastructure policy evolved from a discussion about, I think we've all heard of complete streets. It's kind of a popular term out there. And complete streets, really to simplify, is build the street that you need. Take into consideration pedestrians, multimodal transit, all of those things, or not the need for those things, and build what you need, just what you need. And however, city staff felt that was, while it's a good effort, it was probably something that was a little bit narrow-minded in what we wanted to attain with our sustainability. And so we decided to take more of a comprehensive look at the city's infrastructure in general. And knowing that our capital improvement program is really the driver of our investment in our infrastructure and the things we do in the community, how could we incorporate sustainability into that program, which allows us to plan for things in advance. And so we can provide opportunities for sustainability to the council by giving ourselves time and planning instead of bringing something to you as we're trying to fund something, and then you've got to come up with funding, and it's short term, and it's a little bit more difficult to handle. And so the other part of that is we also want to look at sustainable infrastructure as just that, infrastructure that our community wants, needs, and can afford to have over time. And so an important part of our program is cost analysis and cost-effective sustainable strategies, and evaluating things that help the environment, meet our community needs, but also meet our long-term needs to maintain our infrastructure and do it at a level of service and cost that our residents can appreciate. And so from that, our committee, which is made up of members of city staff from basically all walks of city life, came together and developed a policy that provides some guidance. And it really looks at balancing our long-term fiscal, environmental, accessibility requirements. Because oftentimes it feels like you can only have one of them. You can't have all three. And so we want to try to take a balanced approach and pick and choose within our CIP projects that are going to allow us to do certain sustainable elements. And so with that, we set up key factors such as mobility, environment, safety, cost. Those are really the things we wanted to evaluate. And so we developed a policy and a checklist or guidelines that would help us evaluate those processes. And we don't, one of the things that's sustainable is we don't want to create committees and different things to incorporate that. Those tend to have a limited life, and they don't really carry the momentum. We have a development review committee at the city already. We really wanted to task that committee as part of their annual analysis of our capital improvement program, make sure we're doing things sustainably as a group. That group is a sustained group that brings together expertise from all areas of the city, and they can approach projects in that way and identify those sustainable things so that we can in Public Works incorporate or consider incorporation or allow the council the chance to incorporate them as we move them forward. And we identified 4 key areas that we felt really, and much of the credit goes to Sue on this, is she identified areas such as safety, mobility, community, and environment that allowed us to tie in the council's ends and outcomes. They really, all our ends and outcomes are encompassed in those 4 categories that we will use when we evaluate a project. And so that was something that was important to us, is we wanted something to build off not only our sustainability plan, but the ends and outcomes that the council's laid forward. And we feel like this will help us get some of those goals and make sure our infrastructure goals are staying on track with our ends and outcomes. And so what you see up there is I just quickly today took a look at our ends and outcomes and the guidelines that you had passed out to you. It really hits on those different areas, and so we encompass all of them. And so that's something that's good for us. And so what you have before you tonight is a policy, and we laughed a little bit because this is the first opportunity the council could consider approving a policy under your new guidelines. And this is a minor policy. It's not what we would consider controversial. It's more of a guideline to city staff on how we want to approach things. And it's certainly something you could take action on tonight, or something that we can bring forward in the future to a council meeting, especially since we have 2 of our councilors not present tonight, if that's something the council wishes. But the policy is pretty straightforward. It just lays out the process by which city staff will make sure we're incorporating the goals of sustainability. And as I mentioned, those are our environmental goals, our community goals, safety, but also incorporated in that is fiscal responsibility and making sure the things that we construct are sustainable from a cost standpoint too. So how we would weave those into our development review process and our project process. So really, when the council's approving projects, you know that you're also, each project has been evaluated for your sustainability goals, and if there are goals that we can meet, you've had an opportunity to weigh in on those goals. Not a new process, just building off of the processes that we have. And so that's really what the policy identifies. And it also says that as we update other policies or review them, we're going to take into consideration this. We're not going to go in and open up all our policies and try to revamp them. That's too time consuming and staff consuming. We're going to be smart about it. As policies need to be adjusted, we're going to take a look at that. Sue will talk in a few minutes about some resources that she's already looking at to bring in free of charge to the city to do that evaluation for us. So that's what the policy is that you have before you tonight. And so when we're done, we'll answer any questions you have about the policy. And again, you could consider action on this if you'd want. And turn it back to Sue for kind of the final steps.
Okay, for next steps, this year, we were thinking that we would like to take a look at the Minnesota Green Step Cities program. It's an MPCA program, and it's recognition through the Minnesota League of Cities. So we'd like to go through that and see if we have gone through it preliminary, and we're, above and beyond pretty much some of the, most of the requirements. Also, in 2011, we're thinking about doing the greenhouse gas inventory for city operations. We did that in 2009, and it would be for 2011. We do it this year, but for last year's statistics. And then also, I talked to the University of Minnesota Graduate School, and there is an opportunity for us to move forward with a capstone project that would look at our sustainability plan and also our ordinances, and do an audit of those, a policy audit, and see if there's places that perhaps are in conflict or that maybe need some additional changes. And then consider the approval of the policy, sustainable infrastructure policy.
Okay. Questions? Bill?
So why would we have the U of M capstone project do that? First of all, does it cost us anything?
No, this is, they're using it as their final project for graduate school. And there's a team of students that would be coming in and taking a look at our ordinances and policies that we have on the books. And as Steve was saying, that there may be some differences between what our sustainability plan is suggesting and what some of the ordinances require.
And the better alignment?
A better alignment, thank you.
Could you give me an example of one?
For example, we may have in our subdivision code restrictions on street widths or something of that nature. But from a sustainability standpoint, we as a city may feel that in certain instances, when safety is not compromised, we can go with narrower streets. So they would identify for us, here are the changes you would need to make in these ordinances or these policies to give yourself the flexibility, and then we would be able to consider that. And that's really the most time-consuming part of putting together sustainability is you think about our code book, and then you think about all the policies we have on top of it. You've got to go through all of those with all these sustainability goals and figure out how they all play together, and that's something that we would put off into the future. But the nice thing about using the university, and I've used them previously when I was in Prior Lake, to do, basically it's volunteer intern. You're getting summer interns essentially year round to do some work for you at no cost to the resident.
Eyes.
Yes.
They've got young eyes looking at all of this, and they can be very judicious about the way that they audit.
Thank you for that explanation.
If that makes sense.
Yeah,
Mary.
I have a question regarding the greenhouse gas inventory for city operations. What do we do with that information?
We did a baseline study for 2005, and then we did it again for 2009, and we look at where we're going as far as it's really an energy audit, basically. So we take a look at our energy consumption, and it has pointed out a number of things, as far as where we're spending the money, where we're spending energy money, and where we can figure out ways to reduce that, because when you use energy, that's greenhouse gas emissions. So one of the things that came up that we were surprised about with the last greenhouse gas inventory was that pumping water is our highest electricity cost. And who knew that? We didn't know that. So that's been interesting, and we've had discussions about how to change that. And some of our building, the ice center was very high energy use, and we've looked in, we've done the geothermal, so that's been a big change with that.
That one we can measure specifically to $70,000 reduction in energy costs just by going with geothermal. And so what you're saying to us is that doing this inventory, and I've seen the value because I saw the 2005 report, so we understand the baseline. This is where we were, and what we need to do is reduce that, and reducing that greenhouse gas emission reduces our energy cost as well. So it is also cost benefit. One of the things that I wanted to point out is that I really appreciate what you did with the guidelines that you have in place, because, again, you're knitting very carefully all of the ends and outcomes to your guidelines, so how decisions are made that are brought before us for us to make decisions on whether we move forward or not. But it also gives you that flexibility in really making common sense decisions about how we look at our infrastructure or our codes and our ordinances in a very common sense and reasonable way, rather than here's the policy and it has no connections or alignment to a particular decision. Craig?
Madam Mayor and council members, I think that might be what sets the Burnsville Sustainability Plan apart from others, is that it really does seek to do the right thing for the environment and for sustaining society, but it's got a very heavy dosage of money. What makes economic sense? And Sue pointed out a few of them. It made sense, especially when we got the grant dollars to draw the payback period to virtually hardly anything. It made sense to put a geothermal system in at the ice, meaning we're saving $70,000-$80,000 a year. It makes sense for Steve to install variable frequency drives at the water treatment plant. Even though they cost some money, there's a great payback on them. It makes sense, even though it may sound trivial to people, to save lots and lots of paper, but that sort of understates even that, because what we've really saved is probably half of the number of printers we usually have to have. So it saves capital costs, it saves energy to run those printers. I think, there was a great deal of skepticism when the first sustainability plan came in, and that it's going to be a boondoggle and spending a bunch of money for some senseless environmental things that don't bear any fruit. That's not the flavor of Burnsville's policy at all.
And it's been really nice to report on these results that Burnsville had, just because we had a baseline, and reporting it on a national level and also just on a regional level. Other cities are now looking at Burnsville's sustainability plan. When we were going through and saying, what would our plan look like, we looked at Minneapolis's plan, and it had no nexus of alignment to their goals and objectives. And so here we did our own, the way that we do it, and it has very specific goals, and it also looked at cost reduction. And so that was really one of the big things that was a great pleasure for me to report on a regional level and on a national level on those outcomes, those results. Mary?
Well, I know the last thing on this list is to consider approval of the infrastructure policy. I think that you've done a good job here, and I really like the broad thinking that you're doing on this. But I am a little reluctant to approve it without the other two council members here, so I think we ought
Bring it
to.
on a consent
Yeah.
agenda, and if they want to pull it to know more about it, they can pull it to
Yeah,
know more
they're not
about it.
likely
Because
to,
they
but,
can- yeah.
but
The
I
thing
think
is
that we
you
need to
know,
do that, yeah.
They're probably watching us also.
Oh, I'm sure they are.
Very minimal effort, very minimal effort
And
to
then,
take it
and
put
we
it on
can
the
tell them, go, if you haven't watched us, go,
Dan's at a funeral, you mean he's watching this?
and Dan's at the CES show.
I don't think they're
Consumer
watching,
electronic- no.
Madam Mayor, I don't think they're watching.
Well, they can go to the internet and stream it. But
yeah,
yes,
thank
and then
you.
we'll just put it on a consent agenda.
Will do.
Okay.
Thank you.
Okay.
Thank you. Very well done, Sue
Yes,
and Steve. Thank you
Nice
so
job.
much. So when will this report be out, Sue, so that I can incorporate it on your report?
Will be probably finished by April, I'm guessing.
I was just in April. So I can submit it nationally then in June?
I'll have that goal. Thank
Okay.
you.
Thank you. Okay, the next item, Tom Hansen is going to talk about the naming rights policy for non-park assets and recommendation for Council Member Crichton's recognition. Tom?
Thank you, Madam Mayor, City Council. This is one item that actually has been around for quite a while. You'll recall that after Councilmember Charlie Crichton died early last year, it was brought up at the council to come up with some ideas on how to honor Charlie's memory after having served so long on the city council. And so that's one half of what we're going to talk about in the next few minutes. And the other half is naming rights generally on non-parks assets. They're related. Thought it made some sense to join them together tonight for a relatively short discussion. Some of the ideas, as you recall, for honoring Charlie were to name a street after him, perhaps a city building, a dog park came up, a number of different ideas. The council actually instructed staff then to go off and see if we could find a appropriate way to do that. And we passed that along to the PNRC, Parks and Natural Resources Commission. And in speaking with Terry Schultz, our director of Parks, he indicates they had 3 discussions on this item. It was fairly lengthy. You might have read in some of the minutes some of the discussions that took place. They came up with a lot of ideas. A forest of honor, a trail of honor, a community garden perhaps, a tree planting, variety of different things. In the final analysis, Terry Crichton, Charlie's widow, actually weighed in on it and expressed an interest that perhaps a plaque at or near a bench near the small dog park at Alamagna would be most appropriate. Consequently, they did make that recommendation as a board for your consideration. And if you were to accept that and direct staff to follow through with it, we would plan an appropriate dedication ceremony in the spring.
Yeah. And members of the council, I've had a long conversation with Terry about this. That was very meaningful because it was a place that she and Charlie enjoyed, and Charlie loved their dogs. And it was a place that he had a lot of joy. And so for her, this was most appropriate. And it had significance for her, and she thought that that would be something that Charlie would really like because it had meaning. It was a place that she and Charlie and the dogs spent some very enjoyable time. So,
Sounds good to me.
sounds good to me.
And I would think that Terry's wishes would be the
And I think-
driver on this.
Me
definitely.
too, yeah.
So are we allowed to make a motion then?
Yes, on this one.
So I make a motion that we approve the
The plaque. at
plaque
Alameda.
on the, at the dog park on the bench.
Second.
All in favor, please say aye.
Aye.
And now that, we can move forward with that and start planning an event.
Absolutely. Thank you,
Okay,
Madam Mayor
thank
and
you.
Council. The second item we'll be talking about is the naming of non-parks assets. We have a parks assets naming policy right now.
Yeah.
That's generally where most naming rights come in, but the council asked for some background on this. And interestingly, most cities don't have a policy on this. We asked around. The only city we could find either in Dakota County or adjacent to us was Bloomington that actually had that, and that was included in your background. Actually, very good policy, I thought. But most cities, if they decide to name a non-parks asset, a street or a building or a conference room or something like that, they tend to do it by resolution. It's on a case-by-case basis. They basically hear whatever the proposal is and make the decision. So that's always an option for you if you want to do that, as you could right now. The city attorney advises us that you have wide latitude on deciding what to name for whatever purpose you may desire. His only concern is if you ever name something and actually do it for financial considerations, that you do it for a duration, a very specified span of time. Otherwise, your purview is quite wide on it. There's generally two reasons for naming, and that would be to honor a person or an organization for conspicuous achievement. It could be generosity, it could be lifetime achievement, it could be a variety of different things, but it would be an honor basis. And the other would be for financial considerations, like the Performing Arts Center. You might want to sell naming rights to the Performing Arts Center for a financial consideration for a period of time. Here's the kind of assets. We actually got a group of employees together, talked about, well, what do we really have for assets? What could be named? And really it comes into four categories. So the buildings, of course. We've got fire stations, City Hall, the Youth Garage, Performing Arts Center, things like that. We have streets and sewers. I can't imagine anybody wanting a lift station named after them, but you never know. It's possible.
Craig wants a lift
me
station.
too. I like sewers.
Wells, water towers, sidewalks, things like that. Spaces within buildings is actually an interesting possibility. Conference rooms, lobbies, this chambers could be named, or community rooms. And equipment. Trucks, squad cars, fire vehicles, ice resurfacers. It's as an interesting item. We actually did have our ice resurfacers with advertising on it many years ago because they were provided free of charge. I think it was Columbia Resurfacers, but that was in compensation for us actually using their machines. But kind of moving forward on this, before we develop a policy, and the goal of this tonight is actually to have you give us direction on what kind of policy you want. And the Bloomington example is a good one. I mean, it could be structured like that if you want a policy. But what I hear from you, we'll take back, and we'll come back with a policy that beats whatever direction you give us. So we put some questions together for you. And it's broken up into the two areas, naming rights for financial considerations and the naming rights for honoring people and organizations. So as far as financial considerations, I think it's never been said publicly that I know of by the council that the PAC is clearly a good candidate for naming rights.
And they're already working on.
They're definitely working
and they've
on
been working on that for.
But that one, I
putting the
think it's
marketing
just for the record, I think everybody agrees that would be a building in Burnsville, kind of, that just stands by itself as being up for funding of naming rights. What about other city assets? Should they be considered marketable? Water towers, streets, city council chambers? What do you think about that in terms of a policy?
Well, I have no problem with the PAC. And I think because I think that's part of the culture. I mean, we have the Target Center, we have other
models out there.
other models out there, both in the metro area and in other major cities in the U.S. So I have no problem with that. I'm not quite as comfortable with the water tower, streets, chambers. No.
Yeah, Bill.
I'd go as far to say I think it's a bad idea that I somehow think that if I created a company that I'd come down and make the city an offer that I could put my company name in the council chambers when these are really
that wouldn't
citizen.
look good. Yeah.
These are really citizen assets. There are some exceptions, as we just talked about the BPAC, but at the end of the day, I like the idea that it's left for us a very significant honor and not otherwise.
Not commercial.
That, right, that we'll name City Hall next to City Hall. I'll put up my law office advertising because I gave $10,000 or something. It just sounds bad.
Yeah.
That we've not come to that yet.
Yet. I agree. The Performing Arts Center, this is standard practice throughout our country that people buy naming rights for a limited amount of time. And that's a practice that we said yes for the commissioners to move forward with it. But I agree. And I've talked to some folks about renaming streets. Very difficult. Businesses, it's changing their addresses and everybody, and even residents. I said, so somebody wants to rename my street, that means I'm going to have to tell everybody that my address is now changed. The first thing was, no. Leave it alone.
Well, you also run into offending people. My mother-in-law, who is very Irish, never got over the fact that they changed in Chicago Crawford Avenue to Pulaski Road. Never got over that. So I think we have to think about,
the
just
impact
don't do
on
that.
residents and businesses and all of that. So renaming streets is a hard thing. I know that we renamed Ames Drive. It was one, but the thing is, it was only their business and there with one other.
It was a numbered street, wasn't it? Yeah.
And it was a numbered street, and it was also, it was just their business on that street and Waste Management, and they only had to talk to one other business, and they said, yeah, that wasn't a big deal.
And I think you raise a good point with that, and that is whatever the policy is, there also should always be some council discretion for dealing with that kind of issue.
Yeah.
So I would think.
Seems like what I'm hearing, Madam Mayor, if I could jump in, is that certainly the PAC is a clear exception to this, but everything else would probably be by exception only, and probably by the resolution process that other cities would use. If a really wonderful exception came along, we could staff could bring it to the council and make a case-by-case decision on it. Would that be a fair summary?
Yeah.
And I liked what the Bloomington policy, I mean, I thought there was some good language in that.
Yeah.
So, maybe you
There
could
was
come up with some.
something that staff put in here that I thought was really good too, was the historical.
Well, that's getting to my next couple slides. If I could.
Okay. See, we're just jumping ahead of you all.
I know. We're too slow for you. So I think we answered the questions on this first slide as far as the naming rights for commercial interests. Now, naming rights for honoring people and organizations. This is a little different. There's no commercial interest involved. Should all city assets be considered eligible to be used for honoring? And I think you answered partly here that certainly the streets, things like that are problematic. But what about other things? If someone were to have an interest in an asset, let's say something that we could honor them with for maybe an unnamed street, or no, that's not a good example.
Because every developer who does it, they name their own streets, and then they file it with the county is how it happens.
But some of the other assets that we talked about, would
I'm
there be any
thinking
interest
of downstairs, the meeting rooms A, B, C, and D. I mean, that's
for honoring people?
That's not very colorful. I mean, maybe that might be an option if.
Yeah,
if
but
we chose to do.
how would we?
I don't know. Well, that's where I think Bloomington's process is interesting. They do have a list of criteria.
Yeah, there's a fairly significant list
It's
of criteria.
quite detailed, and obviously, I mean, if you followed their guidelines, not everybody would qualify.
They limit it to one per year. And
Yeah,
things like
there are a lot of limits on that.
Bill?
Actually, after hearing the whole discussion, I really like the case-by-case basis. We've not run into any problem in my short time on the council. And while it took a little while, I think we've come up with a great resolution for Charlie Crichton.
Yeah, because it was thoughtfully done and vetted to the point that we came down, this is the widow's wishes.
And it's like everything else. I haven't seen that we've run into a problem that we need another ordinance to solve, at least unless my more experienced council folk tell me otherwise.
Well, I think Bill makes a good point, but I'd keep this Bloomington thing handy just in case.
Let's go to what Mayor Couts was alluding to, another idea that came out of this. And it was actually building on a PNRC idea, and theirs was to have a path of honor or something like that. identified.
Right here in Civic Center Park.
And this was an idea that staff elaborated on it a little bit, and it would basically be a landscaped pathway that would actually be.
But-
Go ahead. Sorry, Mayor.
We already have that down at Nicholas Commons Park.
No, it's only for military personnel.
No. Well, we have a we have a walk of honor, but we have pavers in that park that have honored city employees who've retired. You pay for it. But there are a lot of spaces left down there, and there's room to have a path down there. I mean, I would hate to see, now, I do serve on the Burnsville Community Foundation board, and the board uses that to help raise money for the community foundation. But I'd hate to see a competing path. Really would. I'd really object to that.
Okay. Well, this idea, just to finish the thought,
Yeah.
was that it would
Sorry.
actually be an area where things like what just came up with Councilmember Creighton, if he had such a history of leadership and achievement for the city, that he would actually be part of this path with a plaque or a pedestal and, and a very nice thing. It would be almost a history of the city's leadership and people that have done great things for the city. And there'd be, again, a vetting process, a nominating process and all that. And as these types of things came to the future councils, you'd have a ready-made place to say, yeah, this person is of it's such significance, it would be going into this path of leadership or something. That may not be the right name, but that was just one idea that was thrown out there for you.
Bill?
Again, I look at the proposal that Terry Creighton came up with, which would probably not have been at the top of, anyone else's list, and that was her preference, so that then we would be maybe trying to make decisions for others that may want just a small token or something, or no token at all. So I don't,
Simpler, sometimes better.
Yeah. Okay, so what I'm hearing then is just leave it alone and we'll do it on a case-by-case basis.
Let's do that.
And we just do the Charlie thing, and then, Mary, there is opportunities for.
At Nicollet Commons Park.
Nicollet Commons
Yeah.
Park for anything like that to happen, and there's some big pavers and some small pavers.
There are a lot of places down there. Yeah.
So there's some opportunities down there that something can happen.
Yeah, definitely.
Perfect.
Okay.
Got all the answers we
Thank
needed.
you.
All righty. Got that done. Now we go to roundtable, and this is for to discuss moving the February 7th meeting to February 6th because of caucus. Michelle? Craig? I think it's
Madam
self-explanatory.
Mayor, I think the statute says that we shall not meet within so many hours of when the caucus goes on, and we were pretty confident the council would simply want to move to the 6th, but we need for it to be official.
Yep, and I,
Do you need a motion?
no.
Okay.
It's just that so our citizens know that the meeting is going to be held on a Monday and not a Tuesday.
Okay.
And the reasons why. Okay? And then the other one is filling the vacant Economic Development Commission seat. And council, we do have an alternate. And one of the things we can do is move the alternate to a regular, and then in about 4 months, we will be appointing, and then we can appoint a regular member. Is that it?
I make a motion to
Yeah.
approve your proposal.
Yeah,
Yeah.
and that's Craig Reber. Then we'll move him up.
Yes.
Oh, God, where is this?
Okay? And did you second that?
Yes, and I think that makes a lot of sense because there's really not that much time left before we would.
And they only have 4 or 5 more meetings before
Right.
we appoint again. Okay, and did you second Bill's motion?
Yes, I did.
Okay, all in favor, please say aye.
Aye.
Opposed, say nay, and the motion carries. Very good. Now, Bill, do you have anything to report?
I do. When I attended the Black Dog Water Committee, 90% of the meeting simply went over, Dakota County was there, and they went over the rain garden event, including showing a movie. And we've already received a report on that earlier as part of the sustainability matter. And I can report it seems to be going well.
Oh, good.
And I did not attend this last time, the Park and Rec, because they made the important decision on Mr. Crichton the meeting before.
Okay.
And that's all I have on that.
And you can watch it from home also.
Yes. Oh,
Okay, Mary?
The only thing I have to report is regarding DCC, and there's been new CAD software installed, which was operating fine until last Friday. There was a complete outage, and since then they've been experiencing additional software issues. And they brought these concerns to a special meeting of the Joint Operations Committee, and by unanimous vote, they decided to, hang on, I'm reading here, to roll the CAD and mobile operations back to the former system. And that it happened this morning. Now, I just want to emphasize that the public was not impacted in any way over this. So, but in case there were rumblings out there, I want you all to know that that's what happened. Okay? That's all I have.
Okay, and we at the Regional Council of Mayors meeting, and on the agenda was the Met Council's framework, and so they came to report to us the process and how they're going to go through that. So I asked that they sent us an electronic copy of the PowerPoint so I can send it to you, so you'll see
Good.
the process and the timeline of how they're going to execute that whole process. And Ann Beckman and John Kerry were the ones reporting. And fiscal disparities has great legs. And so there were some new mayors, and so we had a Fiscal Disparities 101 for mayors to understand the scope and why we're going through this. And then I did ask Tom Pohl, who is our staff member from the Municipal Legislative Commission, to be present because we're the ones who've been driving to get this study done and why the study. So there was a Fiscal Disparities 101, and that was reported by Deborah Dietrich from the Met Council. And then we also had Steve Hines from the House Research Legislative, and he's a House Research Analyst. And that's getting a lot of interest from a lot of folks to really understand fiscal disparities because it's such a complicated piece of how revenue sharing happens in our metropolitan region. And then we had reports on transportation and land use and that effort that's going on. And also just reports from our working committees like Environment, Housing, and Jobs. And those efforts continue. And of course, our Municipal Legislative Commission only meets on a quarterly basis, so that's where that's at. And last month, you all received letters from the chair of the Planning Commission. They had had a conversation and talked about the term limit, so you've already received that. International Festival, we're up and running and going to be ready for the festival in June. And so the meetings are on the way. And then our Convention and Visitors Bureau meeting is coming up, so. And that's it. Bill?
I would,
Go ahead.
can you hand this out tonight?
I did.
Oh, yes.
Madam Mayor,
Oh, yeah.
Councilmember
So I-
Coughlin and Councilmember Gustafson
Yes.
requested a brief discussion on a contact that they've had regarding the liquor ordinance, our off-sale liquor ordinance, and the time restrictions on it, and whether council would be willing to consider potential amendments to that to make us consistent with surrounding cities.
You know, I see no reason why we can't comply. I mean, I don't know why we had an 8 o'clock.
Just because we never changed it, I think.
And so the thing is, and the statute, because there was no law that says that we had to close at 8.
I think there used to be,
For the state,
yes, and then they changed it. And then other communities changed it,
and we never did.
it just never came up.
So no one, not until now,
Correct.
that the liquor store owner says, well, we want to open
2 more hours to
Yeah.
pick up a little extra
I don't have
money
any
to.
I think, why not?
And I will represent that it's been represented to me that they've talked to several other liquor stores who are in favor of this, in Burnsville, of this same.
Yeah, and the thing is,
Change.
it's up to them. If we say 10 o'clock you close, and they want to stay with 8, it's a decision that the business community makes.
And just to make the point, Costco closes at 6
Yeah.
on certain evenings, so you can pick and choose.
Yeah, but the thing
Correct.
is, we're saying we're now, following state statute.
Correct.
I'm okay with it.
I'm okay with it.
Okay, so then, Craig and Michelle, it comes to the meeting then, because there has to be an amendment to our ordinance.
Oh,
Yeah, Craig?
Madam Mayor, perhaps Tom was going to raise this issue too. Do you want us to do any advance work with the existing store owners to
Just let them know.
let them know and to talk about potential changes and so on? What else, Tom?
Yeah.
I think that should do it. I don't think there's really any other significant issues.
Do we have to have a public hearing on that?
No, it's just an amendment to the ordinance.
so do we make a motion to
No,
approve?
it's just going to come, we're directing staff to make the changes to the ordinance, and it comes before us at a
On the
council
cons-
meeting.
Or
Yeah.
on the consent agenda,
Yeah.
perhaps?
Yeah. And what staff will do is write a letter to all of our liquor store owners, letting them know that they can close at 10 if they so choose, or close at 8 if they so choose.
And if one of those owners asked, what sort of time frame would be reasonable to estimate that that would go into effect?
Staff, when will,
We don't,
next month?
Ms. Brooks, I don't think we have a publication requirement, so it could be as quickly as we could get the ordinance to the council. Could certainly be within a month or two at the outside. I would think closer to a month.
Yeah, just make.
4 to 8 weeks, depending.
Yeah.
Okay, great,
The other is just the notification to other
great.
store owners. Because we have a meeting next week, and so the first time they can bring it to us is in the first meeting in February, or not
Okay.
the second.
Great, thanks.
Okay, very good, thank you. Anything else? If not, a motion to adjourn.
Motion to adjourn.
All in favor?
Aye.
And aye, and we are adjourned. Thank you for being with us, and good night.
Thank you.